I want to get to this situation that we've seen develop with the Texas Democrats. The CDC director has referred to the state we're in now as a pandemic of the unvaccinated. But we do have a developing story about the vaccinated. We're seeing this more than in just the case of the Texas Democrats. But when you saw that photograph of the 50 or so Texas Democrats on that private plane, all without masks, looking like it was a normal plane ride of a couple of years ago, did you look at that picture and worry for them?
Well, Lawrence, I didn't see the picture, but what I can tell you in general is that if you are on a plane, if you are on a train, if you are on a bus or on a subway, the guidelines say that you should be wearing masks to protect yourself and to protect others. The vast majority of infections we're seeing, Lawrence, are among the unvaccinated. And the vast, vast majority of hospitalizations and deaths, more than 99.5% of deaths, are among the unvaccinated. But the vaccines, as highly effective as they are, they're not 100% effective. And there will be a small number of people who have breakthrough infections. And that's why, especially if you're in an area where there's a lot of infection brewing, or if you happen to be somebody who's immunocompromised or who has unvaccinated people at home, you may choose to even take extra steps and precautions like wearing your mask indoor settings. But certainly this CDC guidance clearly says when you are, in public transport or a transport where you're with a lot of other folks, potentially of mixed vaccination status, that wearing a mask is the safe thing to do.
Technically, the wearing a mask rule doesn't apply on private aircraft, which is what that was, but it was 50 people. It looked like a commercial airliner in effect. And they're all vaccinated. So the question tonight, the first question tonight is, what do we, the vaccinated, have to do now? What precautions do we have to take now that we are all aware that there can be breakthrough infections and we who are vaccinated can be infected?
Well, Lawrence, let me step back for a moment. Let's talk about what we should be concerned about if we are fully vaccinated. And to be clear, fully vaccinated means you're at least 2 weeks out from your last shot. Your chances of getting seriously ill or dying from COVID-19 are very low if you have been fully vaccinated. There is a chance that you could still be infected, but it's very low. These vaccines, especially the mRNA vaccines, have a more than 90% effectiveness against symptomatic illness. And even if you do get sick, Lawrence, the likelihood is that your illness will be asymptomatic or mild. And so that is all good news. That's the reason it's still so important to be vaccinated. But if you are fully vaccinated, again, there may be conditions where you decide you want to take extra precautions. So, for example, if you live in an area where there's a lot of virus circulating, if you live at home with people who are unvaccinated, if you yourself are immunocompromised and are worried about your risk, in all those settings, it makes sense, Lawrence, to take extra precautions like masking when you go out and mix with other people in indoor spaces. Lastly, I'll just say this, Lawrence. Look, the Delta variant is spreading quickly across our country. We are learning more and more about it every day. COVID-19 has taught us that we've got to be humble about this pandemic. It's certainly not over, and we've got to recognize there's some things, a lot we know, but there are always things that we don't know. And so while a new variant is spreading, a highly transmissible variant, act out of caution. You make sure that you are, that you're not taking excessive risk, because this is not the time to let our guard down.
You just mentioned vaccinated people who live at home with some people who are not vaccinated. I know that's your situation because you have small children who are not old enough to be vaccinated yet. So what does that mean for you? You live in a world where even though you're vaccinated, you could conceivably be a breakthrough case, get infected. Does that mean when you go home that you wear a mask in your home with your children because you fear possibly transmitting the virus to them?
Great question. So I do not wear a mask when I'm at home with my children. And let me say from the outset that this is a place where different people will make different decisions based on their risk tolerance and also based on the community they're living in. Because I live in and travel to communities that have at times high rates of circulating infection, what I do is I wear masks when I go outside, especially when I'm in indoor spaces. I don't wear masks outdoors because the risk of transmission is very low outdoors. But if I'm going to be in indoor settings with people whose vaccination status I don't know, especially in these areas that have high levels of virus circulating, I do wear a mask because I want to protect my children when I come back home, and I don't want to have to wear a mask when I'm with my kids at home.
President Biden made the point today that 40% of the new cases now are coming from just 4 states that account for 40%. Those states are Florida, Louisiana, Arkansas, and Missouri. We have been talking for months now about how you communicate to the unvaccinated to get vaccinated. But what we're clearly seeing now in this information that's out there is that there is an actually politically partisan resistance to vaccination. And the public health system has no experience with trying to communicate across a partisan divide on vaccinations. So what is the next step?
Well, Lawrence, this is one of the challenges we're facing. The pandemic has not only been politicized, but it's been impacted by the tremendous flow of misinformation, and in some cases, intentional misinformation, what we call disinformation, on social media platforms and through other communication channels. And so this is a real threat. And what's happened really, Lawrence, is that science has become politicized. And whenever that happens, what that means is that people lose out because the benefits of scientific discovery then don't reach everyone. So what are we doing about it? Well, a few things. One is we're recognizing that fact and recognizing we've got to be humble about how far our messages reach, even if we have the expertise to understand vaccines and COVID-19. More importantly, what we're doing is we are reaching out and working to support local trusted voices in communities. Not everyone listens to the same people, trusts the same sources in our big, diverse country. But that's why we've worked to mobilize and engage with doctors and nurses in communities across the country. We work to support faith leaders and educators and other community leaders so that they can speak directly to their communities and help folks understand the facts. At the end of the day, Lawrence, this isn't about trying to convince everybody to do the same thing. This is about making sure people have the facts so they can make the best decisions for themselves and their families.